Welcome back to FutureBets web series. This is the penultimate webinar of this series. Today's speakers are coming to you live from Morocco and San Francisco. And for our final webinar of this series, which is tomorrow, check out www.makefuturebets.com. Before we start, the protocol dictates I introduce our group and myself to you. Very quickly then, the Ashika group is a 25-year-old diversified financial services group offering services such as brokerage, lending, investment banking, wealth management, and asset management. I'm talking from our headquarters based in a corporate office based out of Mumbai in India. Our team of 300 plus work together to provide services to over 125,000 retail clients, 100 plus institutional clients, and 100 plus family offices. And I, Ishita Jain, will be your moderator for the evening. I'm part of the institutional equities team at Ashika Stockbroking, where we write proprietary research for unique stock ideas and service some of the top public market funds of the country. I hold a Master's of Biotechnology, Enterprise and Entrepreneurship from Johns Hopkins and a biochemistry degree. Before Ashika, I had a brief stint at a healthcare-focused investment bank on Wall Street. Let's begin today's webinar, the first webinar of tonight, on the Global Markets Reimagined. And for our first speaker for the evening, we have Dr. Nassim Assefi, live from Morocco. Nassim Assefi is a global health physician, teacher, novelist, content curator, health tech consultant, and a civic innovator. Her doctorate is a blend of interim gynaecology, psychiatry, human rights, and public health. Nassim's last full-time job was an interim executive director of MEDICC. Before that, she was director of stage content of TEDMED, which is the medicine version of TED. And she has been a performer selection for TEDMED's annual event. More distant past incarnations include academic at the University of Washington School of Medicine in Seattle, global health aid worker, and underground salsa dance teacher in Afghanistan. Nassim has traveled to more than 50 countries and speaks 5 languages. Awards include a TED Global Fellowship, Hedgebrook Writing Residency, University of Washington's Woman of Courage, Jack Droff and Seattle's Metropolitan's Top Doctor. I think, Dr. Assefi, your bio is as long as the length of this webinar.
Yeah, sorry you had to read the whole thing. I can summarize it much more quickly.
I couldn't have edited anything. So once again, all of us at Ashika welcome you. Nassim, thank you for giving us your time. So the format of this talk is going to be slightly different than all the webinars we've hosted so far. This is more a conversation style as opposed to one thing that I didn't say in your bio is that you are a global COVID-19 expert, Nassim. So I think my natural first question is going to be, before we can talk about reinvention of the world and the industry and things like that, let us address the catastrophe at hand. Can you talk about this COVID-19 pandemic through your lens?
Yes, this COVID-19 pandemic is a big deal for the world at large. I mean, this is the most threatening virus we've had since the 1918 flu. And it's an interesting historic moment because it's attacking all of us at basically the same time, maybe with a little bit of a distance of a couple of weeks of time from the most hit to the recently hit countries. But this is something that we are all collectively experiencing. From my perspective, I sit in North Africa, in Morocco. I'm an American of Iranian descent and someone who's worked all throughout the world. So I have been watching as this pandemic started in China and then has spread in Iran and Italy and the rest of Europe and the United States. And today, the United States has the highest number of cases. So what I have been really worried about is when this pandemic hits the global south, when this pandemic hits the slums of India, the huge cities in Africa, the refugee camps, when it hits the vulnerable for whom what we call social distancing, or what I like to call physical distancing, because we really need each other socially, for whom this distancing is not even a possibility, for whom they lack water. So even washing their hands is very, very difficult with soap, let alone getting access to hand sanitizers. So this is the stage where we're at now. We have about 10,000 cases that are official cases in Africa right now. South Africa and Morocco seem to have the highest, probably because they're doing the most testing. And India, according to the latest numbers I've checked, has a little over 6,000 cases. But we all know this can't possibly be true, right? It's just a matter of who is being tested. I mean, if Italy has over 100,000 cases, and the US has almost 500,000 cases, there's no way that these countries, even though they're behind the US and Italy, have so few cases. So what we're talking about are cases that have been formally tested, and they've been generally brought to the hospital. And we know that these are vast underestimates. So while I watch in horror as my own country, the United States, has basically botched the job, has dismantled its public health infrastructure and pandemic preparedness, has not been testing enough, is short of ventilators. I just shudder to think what's happening in poorer countries who don't have trillions of dollars of economic stimulus. So I'm sitting here, tomorrow will be week 4 of a martial law enforced house arrest for those of us in Morocco, which means we can go out for groceries, medical care, pharmacy, or essential work, but you have to have state-issued paper for that. We have curfews at 6. And if you were found to not be following these orders, it's a 1 to 3 month prison sentence is your punishment. So Morocco's taken this very seriously. We have so much traffic with Spain and Italy and France, you know, who have many, many more times the number of recorded cases than us. So the only thing the government has been able to do really expeditiously is shut down society as much as possible. And we know from data the world over that this distancing works if you're able to do it, if you have the privilege and the money and the social capital to do it. So this is a very special moment in history. It is a strange and unsettling time. And as usual, I'm worried about those for whom life has not given them a nice lot, who are suffering and poor and vulnerable, most of all. But everybody is going to suffer in this. It's just that they are going to suffer the most.
That is actually a very truthful perspective, Nassim. I'm going to come back to that point, which talks about the government shutdown and its repercussions. But before that, I'd like to, since you are a physician, I'd like to get some sense on you may call it the brighter side of the story is the therapeutics, with efforts being taken to repurpose existing drugs like remdesivir, ivermectin, hydroxychloroquine. Where do you see the therapeutic success stemming from?
It's really hard to tell because this is a novel virus, even though we know of now 7 coronaviruses that impact humans. And this one shares many features with SARS and MERS. We don't have a vaccine for either of those 2, nor do we really have therapeutics. So this is a very new effort to come up with therapeutics and a vaccine. I'm going to answer those 2 a bit at the same time. The bright side is we have never had as much technology at our fingertips, as much global collaboration, as much open data. So there's really a lot of potential for faster than ever therapeutics and a vaccine. Now, in terms of repurposing old drugs for this new virus, I'm not going to place bets on any of them, to be honest. For instance, hydroxychloroquine or chloroquine, as you all in India know, probably very familiar with this drug to treat malaria, if not rheumatological diseases. There's no really clear mechanism of why this drug should work. They think maybe it interferes with the virus's entry into the human cell. Maybe it's going to interfere with the overactive immune system, this cytokine storm, the way it's an immunomodulator in people who have rheumatologic diseases. But we really don't know. And the data so far has been weak. And luckily, there are some global clinical trials taking place that will give us definitive answers pretty darn quickly. Same with these antivirals that are currently being used for conditions like HIV and hepatitis C. We can certainly try them. They haven't shown impressive results yet, and they may not. Ivermectin as well. It's not typically used for viruses, but we can try. When we're in this situation where we have a new virus, and in general, viruses don't have easy therapeutics, right? And even a virus such as HIV that's been around more than 40 years doesn't have a vaccine. And hepatitis C, which has also been around many, many years, just recently has a treatment. So virus therapeutics can take some time, but on the other hand, there has never been so much global investment in seeing these therapeutics developed, and that will certainly expedite the timelines. So we should know within a few months for these known therapies and these repurposed drugs. And the benefit of trying out an old drug for a new trick is that we already have a really good sense of its toxicity profile, how to dose it, what to look out for. So for instance, with hydroxychloroquine, which we're using often with azithromycin, you can get some heart rhythm issues. It's called QT prolongation, and that is really something that you've got to monitor and can be deadly. So it's very helpful that we already have this drug. We know that in general it's pretty safe, although it has quite a few side effects, and we know what to look for. And we also know how to make this drug, so we can ramp up production of it if it shows to work. In the case of this particular drug, they're looking both at prophylactic use, which means you take it when you don't yet have the virus, and can it decrease your acquisition of the virus and or COVID, the actual disease manifestation of the virus. They're also looking at the impact in mildly sick and severely sick people. So they're using it at all levels with the virus. There are, I think, 40, 50 trials right now of drugs being repurposed, and you can track those on the WHO and CDC websites. And let's hope if we had a viral treatment that didn't make this virus so deadly, that's certainly going to speed up our return to normalcy. Otherwise, we're going to have to wait for a vaccine, which chances are very good that a vaccine can be made for this RNA virus. They were pretty close to getting a SARS vaccine. There has been an inordinate amount of investment in it. But even the most optimistic timeline is 12 months, but I think it's going to be more likely 18. And by the time it gets made in sufficient quantities and distributed to the rest of the world, I think we're looking at 2 years. So unless we have really effective viral therapeutics, we're looking at about at least 2 years until we return to a sense of normal, even though I don't think we're ever going to return to a pre-COVID world.
That is interesting, the point you made about world collaboration and investment going into finding a therapeutic and a vaccine. Gene sequencing of the novel coronavirus took 2 weeks, when in fact SARS took over a year. Right. But can you shed light on why did SARS and MERS never got a therapeutic? Is that lack of investment, lack of since the curve got flattened and eventually sort of died. Do you think there was lack of investment, or do you think that, why did we not follow up with SARS and MERS?
Well, SARS and MERS are much more deadly than COVID. But here's the deal. When you have a virus that's so deadly and it makes people so sick, they're unable to transmit it as much as a virus like SARS-CoV, coronavirus 2, causing COVID, which, 80% of the time it's mild to moderate. And even there may be about 25% of cases that are asymptomatic, particularly in the young. So a virus, in terms of how it spreads, you're always balancing how dangerous it is and how deadly it is with how quickly it can spread. And in this case, you have one that isn't super dangerous, at least not yet, not in this iteration of it. And it spreads in a respiratory way, which makes it very, very transmissible. So SARS and MERS were far more deadly, so it could spread less quickly. Also, there were containment measures which limited how far they reached. You see with this novel coronavirus, it's reached pretty much every single country in the world very, very quickly. SARS and MERS did not do that. And then thirdly, while there are always some scientific challenges with developing a vaccine, public health is fundamentally also a political will issue. And so there wasn't the political will and the multinational support to develop the SARS vaccine, let alone the MERS vaccine. There is some money and there are some people working on it, but nothing like the amount of global cooperation, interest, and investment today in developing this, this vaccine against this novel coronavirus.
Interesting. That is what I was thinking on the lines too as well. Just more interest, so to say, now to get something for the novel coronavirus, which manifests COVID-19. Let's talk supply chains, Nassim. Some are bound to be disrupted, some are bound to be restored due to lack of alternatives. Where do you see the global market of pharma trending towards?
I didn't catch the last part of your question. Where do I see the global market? What?
Where do you see the global market of pharmaceutical trending towards?
Okay, well, I'm going to answer even more broadly about the global supply chain. Right now, we have been living in a just-in-time, highly globalized world where everything from our personal protective equipment, masks and gowns and everything, even our number of hospital beds in hospitals, even the number of drugs we have on hand, we're operating.
Nassim, I think we lost your microphone.
Can you hear me?
You're back on.
Okay. We're operating right now, healthcare has been operating in a lean and efficient way, which means we don't have stockpiles on hand locally when we run into such shortages. In the past, when we've had disasters, they haven't affected everybody at the same time. Even, let's just take the case of the United States. If you have a hurricane, for instance, it's one part of the country and the rest can mobilize and help them. This is also similar with, let's say you have a tsunami in Japan, right? So the rest of the world can mobilize and help them. In this case, it's very different because COVID is hitting the whole world at essentially the same time. And so what we realize is that we have been depending on globalization and global supply chains, and that puts us into trouble. We haven't stockpiled enough. And I think it's going to make us reconsider supply chains. I think this whole pandemic is going to make us hyper-local and operating within our own borders, which is not something I necessarily want to see, but I understand from a preparedness standpoint. I just hope that we don't lock into our little communities and put up walls and stop the global travel and stop relying on each other. If the United Nations were more powerful and better funded, I think something like the World Health Organization could be an amazing governing body to fairly and equitably distribute some, planet-wide supply chain of essential medicines, for instance. But we're not there yet. And in fact, in my own country, the United States, we're not even, which is one country, right, of 50 states, but federally there's a complete lack of coordination. So, like if the United States can't even do it, I don't blame the rest of the world for not being able to do it. But this is something that we should be working toward.
So do you think globalization will not ever, at least in the near future, go back to the pre-COVID era?
Well, it depends how much we remember history. Some cultures and countries are better at it than others. In the United States, we have a very short attention span, a very short historical perspective. I think for India, history is much more present. It's more of an old world culture. But if we're smart, we're not going to go back to the way things were, because the way things were pre-COVID were also broken. And we need to really think better about resiliency and global cooperation and equity.
Interesting. So these changes that you mentioned, I think, are going to bring some inevitable alterations in the healthcare policy around the world. Where do you see these changes happening in healthcare policy?
Well, hopefully the changes will be good. This shock of the pandemic is also an opportunity to reformulate society as we know it, to revise policies. And I think some of the silver linings of the pandemic may be that we value science and healthcare and equity more than we did before. And why do I say equity? Not because pandemics or disasters or crises make us more altruistic. They may for our small communities and our neighborhoods, but usually not toward the rest of the world. I mean, I'm deadly frightened for what's going to happen to refugees now that all these countries are absorbed with their own problems. But I think equity, because with infectious disease, we're only as strong as our weakest link. And unless we're going to close our borders forever and not let anyone in, an outbreak in a refugee camp or in a Saharan desert or in any major city around the world is going to affect all of us. And we're certain to get more pandemics like this one. And so I hope that in terms of the silver lining, we are going to see a bigger commitment to universal health coverage, to basic primary care, community-based health. I think there's going to be a shift from just hospital-centric systems like what we have in the United States to more primary care and community health systems, and a strengthening of our public health infrastructure in general.
Do you mean health system in terms of for-profit health systems or government-mandated health systems?
I think there's an opportunity to strengthen our governance in the wake of this pandemic. To see that if we leave people out the way we have with our privatized health system, we're all going to be in trouble. So that there is an opportunity to truly commit, as the World Health Organization has also promoted, to truly commit to universal health coverage. Certainly private healthcare won't go away, except in countries like Cuba, where it doesn't exist. But I think there's going to be more emphasis on governance at all levels, and that includes health.
Interesting. So these are some paradigm shifts in the world in the post-COVID age. Obviously, like you mentioned, on one hand, we have the unpleasant changes in terms of what happens to the refugee and people with no state. However, let's talk a little bit about the welcomed challenges. what trends in healthcare or in medicine do you see going forward that would be the welcome changes in the post-COVID world?
Well, when you have a crisis like a pandemic, some hard things happen suddenly in a way that you wouldn't have imagined possible. So there have been regulations that have been relaxed that have made telemedicine, for instance, easier. So one big obvious trend for those who have internet access, and I'm speaking from a global perspective, not everybody does. But for those who do have internet access, even on their mobile phones, telemedicine is certainly going to be much more common post-COVID. It was already starting, but now this is a major ramp up. Similarly, I think you're going to see greater online and digital opportunities in other fields like education. I mean, 9 out of 10 children today are out of school. And again, for those who can afford and have access to the internet, which I think in the future should also become a basic human right and part of government's role to make it accessible, we're going to have much more democratized education that's online. I mean, is it necessarily a positive change to do more of healthcare by telemedicine or more of education online? It's hard to tell, but it certainly gives the opportunity to democratize it a bit and increase the access.
Got it. And in terms of people themselves, here, I mean, till now we spoke about the industry and the industrial trends and things like that. From a people perspective, person perspective, there's going to be a behavioral shift in lifestyle, in consumption choices. How does that, how do you see this going forward in the post-COVID world, considering, you know, there's going to be significantly lower tourism, significantly lower travel, lower entertainment. So where does that go in the coming future?
You know, I'm not I'm not in the business of future prediction, but like you said, there's some things that are fairly obvious where the risk of transmission of an infectious disease is high, such as sporting events, you know, being in a plane if you don't have to be, so leisure tourism, big public gatherings. Pardon?
Indian weddings.
Indian weddings, right? What about even shaking hands and hugging and kissing, right? I think we're going to have to reconsider all of those. Some of them are personal behavioral, like hugging, kissing, shaking hands, or those may be reconsidered. Then you have the whole industries, from travel to online conference, to in-person conferences, to big sports events, which I think are going to take probably a couple of years to get back to any sense of normalcy, basically when we have a vaccine. But I don't think the world's going to be the same post-COVID. And if we're smart, we'll take this as an opportunity to make some things better, right? Robert Poynton has this quote that I love very much, which says that if you press pause on a machine, it stops. But when you press pause on a human being, it can restart. And I think that this is a moment for those of us who aren't swamped, sick, you know, frazzled. This is a moment where we can stop and reflect and reconsider how we want to live forward, how we want to treat our earth, how we want to treat our most vulnerable citizens. So there are some potential silver linings here. Although I also worry that authoritarian regimes are only going to become more extreme. And those are the ones that are winning right now in terms of controlling the virus. And they're pushing their agendas through quietly, you know, in terms of, for instance, relaxing environmental regulations, while people's attention is not focused on life outside of COVID. So it's both. There is a possibility for, especially for the richer countries in America, Europe, Japan, Korea, there is a possibility to rebuild a stronger, better, more equitable country with stronger governance and universal health access. But for some of the authoritarian regimes and poorer regimes, we might see an exacerbation of the current problems of inequities increasing, for instance, of human liberties decreasing. Mm-hmm. So it's a mixed picture, as far as I know, as far as I would predict.
Interesting point, Nassim. I know you have, like you mentioned also, you have traveled the world, you've seen a lot of countries. I mean, you were part of the developed world, but you came from an emerging market and you've seen so much in your life. I'm going to ask you a slightly overarching question from a bird's eye perspective. You briefly touched upon it already, but if you could elaborate more, what should have been or what should be the role of the government going forward, because they have been put in an unprecedented position. How does the administration balance the various goals, health and security being the primary goals and economy and development being secondary and tertiary goals?
Yeah, I think health really is a primary goal. Without health and basic safety and security, so like if you're at war, the first thing you think about is your safety and security, right? So if you think about Maslow's hierarchy, those things, safety, security, a safe house, basic health, food, clean water, clean air, those are all basic social goods. And I think governments have to pay more attention to them, and particularly in countries where you don't have a strong social welfare state, where the poor and the disenfranchised and the vulnerable are left to fend for themselves. So I think we're at a potential time to make governments more progressive and look out for more of our basic common goods. Second of all, they should be more collaborative and transparent and science-based in their leadership. And there's some countries that do this better than others. For instance, New Zealand seems to be doing a great job. Finland, right? And then also there is a big role for government to collaborate with their international bodies better and think equitably in terms of the world's resources, instead of, for instance, the US, pillaging the environment, right? So I think it's a moment where, because we're all experiencing this at the same time, we can look to the collective good, and government is a natural place to start for that. Housing, food, water, healthcare, and also some of the other social determinants of health, which actually impact people's lives and outcomes even more than healthcare.
Absolutely. For the disenfranchised and sort of the daily wage earners, this has been particularly terrible. However, I feel it has been more a feedback loop where you shut down the economy to flatten the curve, and it is those people who don't have any cash savings, don't have a legitimate house, they get affected. But then you have to close down the economy to make sure they don't get affected. And then, like you said, they live in close quarters and things like that. So we will not be able to stop that spread at all. So how do we draw the balance? And, since shutting down the economy will flatten the curve, but it'll have its own repercussions. How does that balance come into picture?
Right. A lot of the economy is informal, especially in a country like India, and people are living hand to mouth. And the same is true in Morocco, where I now live. So like I said earlier, physical distancing is a privilege of the rich. People who can, first of all, people who have homes. Second of all, people who can work from home. Third of all, people who, if they're not working from home, have savings at home, right? So this is not a reality for much of the rest of the world. What governments can do, instead of giving you 4 hours to get all your food and saying lockdown, or sending you out, sending you back to the province where your family is, without any help, is putting intermediate steps in place, saying, okay, tourism is gone right now. Maybe we can repurpose the hotels and put all the guest workers in those hotels, or put all the sick people in those hotels until they recover. For instance, the King of Morocco has a $1 billion stimulus plan to respond to the COVID epidemic, and part of it is COVID related, and the other part is economic related, in the sense of giving people a universal basic income, especially if their industry has been shut down. So back to your question of health and the economy, I think that if you don't have a healthy society, your economy is certainly going to suffer. So if you focus first on getting the pandemic under control, you're going to see later a benefit in the economy. And we've seen this with the 1918 flu. We've just had natural case studies where you look at a city, Philadelphia versus St. Louis, and you look at one which really took the health measures seriously and the other that didn't and was delayed. And you see not only the health systems not collapsing, but the economy rebounding much quicker. And it makes, I'm not an economist, but it makes sense. Like if people are sick and your health system is overwhelmed and at risk of collapse, you're not going to be able to have a functioning economy.
Interesting. That's actually well put. Nassim, I think I'm at the final stages of my Q&A. Is there anything else that I've missed that we should have spoken about? Anything that you feel rather strongly about that should be put out there, especially in India?
I would say for those who are not overwhelmed and for those who are not struggling to eat or stay alive, let's use this as a moment of pause, as a moment of reflection, to think about the world that we want to create post-COVID. It's going to be a rough 2 years. It's going to change the way we relate to each other, the way we relate to strangers, the way we relate to other countries even. But there's also tremendous opportunity to compose a society that is kinder, that is more just, that pays more attention to equity, and also looks very carefully at what we're doing to the planet. Because one of the other silver linings has been, you're hearing bird song, you're seeing peacocks in the streets, you're seeing dolphins in Venice. I mean, the earth is coming back just as we are being shut down. And I think we're going to have a new relationship to what meaning is, what relationships are, what consumerism brings us. And I think it'll also give us an opportunity to reconsider how what we're doing is hurting the environment. This is best case scenario, that we create a better world after this for those that are able. And then we do that for our own countries, but we really have to look toward the more vulnerable countries that don't have billions or trillions to pump into an economic stimulus plan, right? Who are gonna see millions of deaths, who are gonna see the inequities rise. So as soon as we get our acts together, we can't forget about those who were left behind in this post-COVID world.
You mean they're going to see deaths due to COVID?
The rest, yeah. Oh, well, absolutely. I mean, the US right now is poised to have a huge number of deaths, but the whole rest of the world too, especially the global South, we're gonna see a lot of deaths.
But we haven't heard so much in terms of where coronavirus has been in Africa. I mean, it hasn't really made headlines, even in terms of, even if I talk about Australia or South America. You think their wave is yet to begin?
That's right. We're a little bit behind. We're a few weeks behind Italy and the US, but but I am certain that it's going to hit badly in poor countries, and they won't have an opportunity to do serious physical distancing, because that's just not the way their societies work. And they already don't have enough hospital beds, and they already don't have enough health providers, and you're going to see a tremendous number of deaths. Absolutely.
But I was under the impression, what happened in, Ebola. I hate to say this. I mean, I am part of the fortunate world, but the reason Ebola did not become an international emergency is because it only affected certain parts of Africa, let's say the poorer parts of Africa. And that's why even American R&D scientists who were working on Ebola sort of dropped the ball, because it wasn't affecting as fast, let's say, as coronavirus has.
Right.
But, these poorer countries have less globalization. They've less people coming in, coming out. So if they are not sort of producing the virus at home, it's an imported virus. Where is it going to come from?
It's already in every single country in the world. And let's say, actually in Africa, it's been in 52 countries. It's not in Lesotho yet. It's a tiny landlocked country, South Africa, but it's only because it hasn't been measured. The testing hasn't been done. It's already everywhere. And what was different about Ebola is that we were lucky that it happened in these 3 countries, in Sierra Leone, in Liberia, and in Guinea, and it happened in rural areas. It didn't happen in major cities. If it had gone to Lagos, which is not that far away, it would have spread a lot worse. So we were very lucky what happened with Ebola. And it was able to be contained. And as I said earlier in this webinar, remember, Ebola has a very high fatality rate. And so the transmission of it was less than this novel coronavirus, where 80% of cases are mild to moderate, and you have a significant asymptomatic population too. So make no mistake, this is going to affect poor countries. It doesn't seem to have much of a climate variation, not much so far as we know. It's going to rip through crowded areas, and it's going to tax already very, very fragile health systems and social service systems. But this is nothing new. We don't hear about, there's just been a recent measles outbreak in Africa. You don't hear about that in the rich countries. But this virus has spread so quickly that even in poorer countries that have less travel, you still see it, and with its exponential increase, it's only going to get worse. We're in early days yet.
Wow, that is very eye-opening. I think we have actually reached our time.
Thank you so much, Ashita. This was wonderful.
Thank you so much for your time and your really novel perspectives on the novel coronavirus. Thank you again so much. And if our participants have any further questions, I will send them out to you if you're so kind to help them.
Great. Thank you so much. Take care.
Dr. Safi.